Hello everyone, welcome to my channel biomed at prachi. Today I am going to share information about pacemaker. Today in world heart related health problems increasing day by day. There are different kind of therapies, treatments and ways to deal with these problems. It totally depends on what kind of problem is and which kind of treatment suits best for the patient. Today we will see one kind of treatment is pacemaker implantation. In earlier video we have seen angiography and angioplasty. Before starting this new topic, subscribe to my channel so that we will be in touch for every informative video. So basically, pacemaker is a device which is battery operated and it helps the heart to beat in regular rhythm. Before knowing about this device, we will see when this device is needful and how this device is helpful to heart. Human heart is nothing less than compact machine which works continuous from before the time of birth to death. Then what is that thing which keeps stimulating heart to work? Heart's electrical system controls heartbeat beginning in a group of cells at the top of heart. It is also called as sinus or sinoatrial node. SA node is also called as natural pacemaker of heart. It produces wave of impulses which spreads to the AV node and then to the bottom of heart causing it to contract and pump the blood. This process is done in particular rhythm. It is represented in graphical format as ECG waveform. Due to some health conditions and certain genetic conditions, it can cause an irregular heart rhythm. Each time the heart beats, the heart muscle contracts in preparation for pumping blood around the body. A pacemaker is needed when something disrupts this process and causes an abnormal heartbeat. There are some health conditions like sick sinus syndrome, bradycardia, and tachycardia. In sick sinus syndrome, SA node doesn't work as it should work. This leads to an abnormally slow heartbeat or too fast heartbeat or combination of both slow and fast. In such situation, patient may show symptoms like slow pulse, fainting, tiredness, shortness of breath, chest pain and palpitation. In case of bradycardia, heart beats with slow heart rate and in tachycardia, heart beats with very fast heart rate. In such health conditions, practitioners advise for pacemaker implantation. Pacemaker is consist of two parts. First is pulse generator. Pulse generator consists of battery and an electronic circuit to control the generation of electrical impulses. And second is lead electrodes. It is basically sensor part which picks information about ECG or electrical activity of heart which helps to identify missing beat or irregular heart rhythm. Pacemaker is generally implanted under skin nearby heart area to manage an irregular heartbeat. Some advanced pacemaker also have sensors that detect body motion or breathing rate and signals the device to increase heart rate during exercise as per need. There are types of pacemaker. First is single chamber pacemaker. Single chamber pacemaker carries electrical impulses to the right ventricle of your heart. Then dual chamber pacemaker. It carries electrical impulses to the right ventricle and the right atrium of the heart to help control the timing of contractions between the two chambers. Third is biventricular pacemaker. This is also called as cardiac resynchronization therapy. It is for people who have heart failure and heartbeat problems. This stimulates both the lower heart chambers, our left and right ventricles. It makes the heart to beat more efficiently. All these types of pacemakers and this innovation is really helping out people who have heart failure problems. Though it's a life-saving device, there are some risks associated with pacemaker implantation, like infection near site where pacemaker is implanted, swelling, bruising or bleeding at site, blood clots near pacemaker, damage to blood vessels or nerves near pacemaker. Risks are not compulsory, but there are chances of some of them. It is very much important to follow the instructions given by doctors after pacemaker implantation so that chances of risk can get lowered. I hope you all like today's information. Next time we will see new information. Till that, keep learning, do your best. Bye bye.